All right, welcome to the Experience Better video podcast series. I'm Josh Beekler, a physical therapist. With me today, Tyler Jensen, a physical therapist here at the Balance Mobility Aquatic Center. And today he's going to talk to us about a program called BIG LSVT. So tell me, what is it? Who is it for?
Yeah, so I've been at Balance Mobility here for about 5 years. And for the past 3 or 4 years, my biggest specialty has been Parkinson's patients. And LSVT-BIG is a program designed for Parkinson's patients, working on the amplitude of their movements, working on balance. One of the biggest things with Parkinson's is patients no longer have the ability to coordinate movements very well. Their movements become very small, and so we focus on trying to reverse some of that. A lot of Parkinson's is not reversible, but we can hopefully slow the progression.
Right.
And yeah, it's been very successful, and so it's been a treatment that we use every single day that we're here.
Very good. So what's like the course of treatment? What does it look like?
Yeah, so everyone's a little bit different. I would say the course of treatment varies quite a bit, but typically patients are here 3 times a week, working on their balance and strength. If they're here for the LSVT program, it's a little bit more structured. We try to maybe stick to 6 to 8 weeks. Some patients need less, some patients need more.
Right.
And so, our typical population is the geriatric population, and so gains are seen, but sometimes they're not real rapid, sometimes they are rapid, and so it just varies from patient to patient.
Sure. So you talked a little bit about, Parkinson's. It makes your world small. Amplitudes of movement are small. So what does that mean? Like the amplitude. What is the amplitude of movement?
So that's the biggest focus of LSVT-BIG is amplitude, and I really have to explain that to patients. What they notice is they see that a normal step is no longer a normal step.
Right.
To them, it seems normal, but it may be half the stride length of what they typically would have. Instead of reaching for a cup out of the cabinet like a normal reach, they're now very hunched and their movements become very small. And so amplitude is just the size of their movement. Like I said, because of Parkinson's, they feel like they're doing a normal movement, but the movement's much more small, much more cramped. Something else that Parkinson's patients deal with is the amplitude of their voice, and the voice of Parkinson's patients is affected just like any other muscle.
Sure.
And so we have speech therapy here that works on the amplitude of speech for Parkinson's patients. And so that's the thing I like about here is we're a one-stop shop.
Right.
You can have multiple different therapies as needed, and patients do really well with that.
Yep. And you're certified in it as well. It's a process you have to get certified through.
Yep. I was certified about 3 or 4 years ago, and renew that certification every 2 years, and it's been very useful. Nebraska is actually the most prevalent state in the United States for Parkinson's.
Really?
And so there's a number of reasons why they think that is, but that really doesn't matter. What matters is that we get some treatment for it.
Yep.
And so we're very fortunate here to have multiple different treatment avenues for it, and it's been very useful.
Very good. Well, come in and see Tyler here at the Balance Mobility Aquatic Center for really any of your therapy needs. But he, like I said, he's specialized in the treatment of Parkinson's disease. So if you were a loved one or unfortunately have that, Tyler can help you. So the Husker depth chart came out recently. What do you?
They did.
Any surprises? I was surprised. This Martinez kid. Apparently, there's a lot of talk about
Yeah. I don't know. He's really not proven so far.
Right,
I don't know. I thought maybe he would be
kind of a
second or third on the
surprise.
depth chart. No.
Right, yeah.
No. I think he was the one lock. But besides that, there was a lot of question. I got to give a shout out. Aurora's native Austin Allen is actually tied for co-starter at tight end.
Attaboy.
Which was a big surprise. That was big.
Aurora's finest.
Yeah, possibly a starter. Even if he's not a starter, he'll get all the playing time. But I'm excited for this week.
Awesome. All right. Well, thanks for tuning in, and we'll see you again next time.
Thanks.